Balancing the Scales, the Economic Justice Report. This is your host, Vic Bernsdorf, and on today's show, we're going to be talking about these two topics. We're going to talk about homelessness in Nordic countries, also talking about why the GOP hates Obamacare so much. Before I get to those stories, a question from a viewer asked me, Samantha, and Tracy asked me, Vic, can you explain the term sandwich generation? The sandwich generation is a group of middle-aged adults who care for both aging parents and their own children. It's something that can affect anyone whose parents and children need support at the same time. That's a critical difference, okay? That's what makes the term sandwich, because you're locked in. You got on one side, you have children to take care of, other side, you have elderly parents, and you're right in the middle. Folks, as you can probably imagine, taking care of the financial, domestic, and emotional needs of both parents and children places sandwich caregivers under an incredible amount of stress. Get this, folks. The sandwich generation's caregiver unpaid labor was estimated to cost $470 billion. That's in 2013 dollars. Watch a video about the sandwich generation to give you a better idea of what's going on. I'll come back and talk about it.
The sandwich generation is a generation of people who are caring for both their children and their elderly parents. 1 in 8 Americans aged 40 to 60 is currently raising a child and supporting one or both parents at the same time. Is your life on the menu? If you're a traditional sandwich, you're stuffed between responsibilities to your parents and your children. If you're a club sandwich, you've got your parents and your children with an extra helping of either your grandparents or your grandchildren. Feeling full yet? The average sandwich generationer is a 49-year-old woman with a full-time job. She spends 20 hours per week providing direct care for her aging parents, on top of working and caring for her children. She is almost 25% more likely to be living paycheck to paycheck than her coworkers who aren't supporting their parents. That's because she spends close to $30,000 per year on the home health aide who stays with her parents while she's at work.
So there you have it, Samantha. That's what the sandwich generation has to deal with. Incredible amount of stress. You either pay someone $30,000 a year to deal with your elderly parents or your child issues while you're out there working, or you try to fit it in somehow on your job, and then you're going to threaten your job and you could be fired. There's only one way out, and that's for America to get on board with all the other countries, developed countries, who have paid family leave programs. Okay, we need to create paid family leave and make that leave available to all workers. Period. Not just full-time, part-time, full-time, self-employed, temporary, and gig work. Okay? Then we have to ensure the compensation during that leave is generous. Well, it should be generous enough not to jeopardize the economic security of families. And then finally, we have to expand the coverage to all types of families, not just new mothers and fathers. Okay? Now, there are some companies that have this kind of care, like companies like Microsoft do offer caregiver leave to their employees. Employees over there get like 4 weeks of paid caregiver leave. But, we can't depend on hoping you work for a company that has it. America needs a national family leave program for all of its families. All Americans, like the kind they have in Canada and Finland. To finally give parents in America some financial peace of mind, which they've never had. Okay? Well, thanks for that great question, Samantha. And now on to the first economic justice story. Okay, this next economic justice story in the news is about homelessness in Nordic countries. And I'm getting my information today from HuffingtonPost.com and also from the BBC.com. I chose this topic because homelessness is a big problem all over the world, but really it's a very acute, and here in America it's growing worse every year, but also in Europe, in the developed countries in Europe. However, the Nordic countries, one country specifically, Finland, has done an incredible job of reducing its homeless population. Let me give you an overview of the homeless problem in general, though. In America and all across Europe, like I said, homelessness is growing. Yeah, there's still homeless people in Nordic countries, just not that many relative to their population, right? For example, homelessness in Finland, which we'll examine, has been greatly reduced. Only about 5,500 people in Finland are still officially classified as being homeless. Okay? Let's watch a video clip of this country's solution to homelessness. Come back and talk about it.
Finland's dedication to helping the homeless on a national scale has resulted in the homeless population dropping from a high of 18,000 30 years ago to 7,000 today. 5,000 of those are in some sort of temporary lodging situation with friends or relatives. The Nordic community has managed to do this by putting housing first. That's even in the name of Finland's program on homelessness. The policy states that housing is provided without conditions such as obtaining a job or recovery from addiction. It's an approach borrowed from the United States. Housing First has been used in the US in some form since the 1980s. However, it has never been implemented on a national scale, and there lies the difference.
Look, folks, there's lots of reasons why someone ends up homeless, okay? Could be a sudden job loss, or family breakdown, substance abuse going on, or mental health problems that they have. But, most homeless governmental policies work on the premise that a homeless person has to get their act together. They have to sort their problems out first before they can get any kind of housing, right? In other words, they need to clean themselves up before the government will come in and help them out with accommodation, right? Finland, however, does the opposite, which I learned from us. Finland has a housing first initiative, and people don't have to earn their right to housing by proving their capability to manage their lives. Instead, they're given a stable home to begin with, and the Finnish government provides individually tailored support after that, right? Whatever problems they have to overcome. The Housing First initiative was built on the principle that having a permanent house or home can make solving health and social problems a lot easier to begin with, right? The Housing First initiative is a partnership of the state, volunteers, cities, and private organizations. There are no more homeless shelters in Finland. I'll say it again. There are no more homeless shelters in Finland. They all have been turned into state and community-funded housing. That Housing First project believes that it is much more difficult to solve any problems without having a roof over your head, which is absolutely true. Investing in ending homelessness always pays back. For example, the savings in terms of the services needed by one person can be about $11,000 a year. Okay, so this is going to be a personal homeless story. Listen to this. Here are the words of one person who benefited from the Housing First initiative. Okay, obviously his name was deleted for privacy purposes. But he says, homelessness for me meant daily alcohol use. It was not so much about getting drunk, but a way to just pass the time. When I was given an apartment, I spent several months without drinking. You can't get sober when you're homeless. No one can. End of quote. Okay? Another person who also benefited, this time gave his name. His name was Thomas Salmi, who became homeless when he was 18 years old and had to leave his orphanage. He spent 3 years on the streets of Helsinki, where the average minimum temperature in February is like minus 7 degrees centigrade, which is 19 degrees Fahrenheit. And he says, I quote, when you lose everything, it really doesn't matter. You're thinking about suicide. Am I going to die? Is it safe? It's cold, especially in the middle of winter. If you're sleeping outside, you might die. End of quote. Okay? Thomas Salvi, this individual I just talked about, braved 3 bitterly cold winters on the streets of the Finnish capital, Helsinki. Okay? For the past 2 years, Thomas has had an apartment of his own at a large complex run by the Helsinki Deaconess Institute, the HDI. Now at 24, he says living at the HDI has turned his life completely around. So what's the takeaway from this segment on homelessness? Well, folks, there has to be strong political will formed by politicians, personal ethics, and empathy for others. I'll say it again. There has to be strong political will formed by politicians, personal ethics, and empathy for others, less fortunate to find solutions for homelessness, right? You'll find neither in today's Republican Party, okay? A policy like Housing First can be more than 5 times as effective and nearly 5 times more cost effective than currently existing services, right? Look, there's no quick fix in life to all life situations, okay? But a solid base, right, like a home, provides a foundation that can improve the quality of life for the homeless, okay? Now, Finland is a country that takes care of the least of its citizens. So it's no wonder that all Finns generally live better quality lives than most Americans, because their government's focus is all about humanity, folks. It's all about humanity. It's about raising the happiness bar of the human condition for all Finnish lives, including the homeless. Okay, so on to the next story. Okay, so this next story is called, I call it Profits Over People, or Why Republicans Hate Obamacare. So, let's take an overview. Look at what's going on, why there is such a Republican hatred towards Obamacare. You know, when it first started, one of the biggest mysteries was why Republicans were so furiously opposed to the ACA, or Obamacare, huh? Some Republicans say that they just hate anything that Obama liked, right? Which is true to a great extent. Another theory was that Republicans didn't like the tax increases that came along with Obamacare, since they hate taxes, period, right? The real reason, folks, is because when Obamacare first came out, the Republicans had a real problem. They were terrified that Americans, especially their middle class and poor constituents in the red states, would like it when they got it. And then those constituents would realize that they'd been lied to. Let's watch this clip and come back and talk
Republicans have a major problem on Obamacare. The parts that they don't like and the parts the public doesn't like, they are not the same parts. You can see this if you watch Mitch McConnell from Face the Nation. Watch what he says here really closely, because it shows why repeal and replace is going to be so incredibly hard for the GOP.
What you need to understand is that there are 25 million Americans who aren't covered now. If the idea behind Obamacare was to get everyone covered, that's one of the many failures. In addition to premiums going up, co-payments going up, deductibles going up, and many Americans who actually did get insurance when they did not have it before have really bad insurance that they have to pay for, and the deductibles are so high that it's really not worth much to them. So it is chaotic. The status quo is simply unacceptable.
And it's not just McConnell. Donald Trump just gave an interview to the Washington Post. He said his Obamacare replacement will cover everyone. He says that the insurance will have lower deductibles, and it doesn't matter if you can't pay. Somebody's going to take care of it for you. I agree with this case against Obamacare. The law really didn't cover everyone. Premiums, copays, and deductibles, they really are too high. 43% of enrollees have a deductible above $2,500. There are a lot of people being pushed to buy insurance that will break their budget before they ever get an opportunity to use it. But here then is a question that McConnell and Trump need to answer. Are they really promising the Republican replacement will feature more coverage, lower premiums, and copays and deductibles? Asked McConnell's office this question, and they refused to say. His spokesperson just said, quote, he's been clear not to predefine the replacement measures other than to say it won't be one single bill, which is to say they're not sure yet. And fine, fair enough. But here's why this question is so hard for them to answer. It shouldn't be a hard question to answer. It's the most obvious, simple question in the whole debate. But I've read a number of the Republican replacement plans that have come around. All of them will lead to more Americans without health insurance coverage, much higher deductibles, or both. And that's because the Republican vision on healthcare is not to have more people covered with more generous insurance. Don't take it from me. Phil Klein, no relation, is a conservative health wonk and writer who has literally written the book on Republican healthcare plans. And he wrote recently that Republicans, quote, are having a tough time stating a simple truth, which goes something like this. We here being Republicans, we don't believe that it is a job of the federal government to guarantee that everybody has health insurance. Klein also says the Republican Obamacare replacements will lead to cheaper plans that carry higher deductibles. So just to recap, at the core of Republican ideology is one, that not as many people should be covered by the government, and two, that they should deregulate insurance so that insurance can have higher deductibles. Does that sound popular to you? Does it sound like it fulfills any of these promises? Donald Trump likes to say that he's going to repeal and replace Obamacare with, quote, something terrific.
It's got to go.
It's got to go.
Repeal and replace with something terrific.
Here's the hard truth about healthcare policy. There is nothing purely terrific sitting around out there. What you can do, what you really could do, is repeal Obamacare and replace it with something that makes a different set of very painful trade-offs. The problem is Republicans are afraid to say which trade-offs they want to make because the trade-offs they want to make aren't actually that popular. The GOP's real problems with Obamacare are not how many people it covers or how high the deductibles are. Their problem with Obamacare is about its taxes, about its regulations, and about its expansion of government programs. That is not what the public's problems are. It's not even what Trump's voters are upset about. The Kaiser Family Foundation recently polled Trump voters on the Affordable Care Act, and you know what? They like the stuff congressional Republicans hate. The Medicaid expansion, popular among Trump voters. Taxing rich people to pay for poor people's health care, popular among Trump voters. Limiting out-of-pocket costs, popular among Trump voters. Republicans have spent years now trying to destroy Obamacare. And to do that, they've been willing to make whatever argument is politically convenient at that moment. What they have not done is build any support for what they want to do. They haven't even figured out what they want to do among themselves. And so now they're in a tight spot. They've made voters think that they're going to replace Obamacare with something voters like more, something that covers more people, that gives better insurance at a lower cost. And they're not. And what happens when voters find that out?
That gentleman just made my point. Voters will find that out, and they're going to be very angry, and they're going to change parties. Okay, let's take an in-depth look now. What's going on here? Back then, when Obamacare became the law in this country, Republicans were terrified that some, like I said, some of the tens of millions of Americans who will have greater access to health care under Obamacare, they're going to realize that the new law is actually not going to destroy the country, that it is in fact going to improve their lives and tens of millions of other Americans. Many, like I said, do vote Republican, right? Many of the Americans who benefit from Obamacare, are really poor red state Republicans who are devout Republican Party supporters, have been for years, right? For decades, the Republican pitch to these voters has been what? Has been less government is better for you, or what Reagan said, that the government is the problem, right? Look, Obamacare has proven that more government does in fact improve the lives of everyone, including diehard Republican voters, right? That's the last thing Republican leaders want to admit to, okay? More to that point. When Americans were asked whether they support Obamacare, these were the poll results from Kaiser's March 2013 poll. Okay, this is what they were. Tax credits for small businesses to buy insurance, 88% of Americans were in favor of that. Closing the Medicare drug benefit donut hole, 81% of Americans were in favor of that. Extension of dependent coverage to offspring up to age of 26, 76% of Americans were in favor of that. Expanding Medicaid, 71% was in favor of that. Ban on exclusions for pre-existing conditions, 66% were in favor of that. Okay? So what's the takeaway of this segment? Look, the Republican Party doesn't want another successful government program. They don't want another Social Security, right? To remind the people that the government actually can do some good in their lives, right? In other words, a government program that actually helps middle and lower class American households and disproves Republican propaganda about how the government is the enemy. That is the Republicans' worst nightmare. Republican leaders want sick Americans to keep paying through the nose to healthcare insurers, right? Because healthcare insurance companies pay for their Republican Party re-election campaigns. So that's who the Republican Party takes their marching orders from, not their poor or middle-class voters. Well, that's our show for today, folks. Thanks for watching. I'll be back on August 20th with news about these three segments: the German Kurzarbeit program, whistleblower news from the healthcare industry, and I'll be finishing off with a segment on how to detect and protect yourself from Republican and corporate propaganda. Have a blessed day. Always remember, you deserve the government you vote for.